Thank you, Manos. Thank you, Bassem. I'm very glad to participate to this Congress that is getting year by year very impressive. So I'd like to start. Okay, I use a balloon spacer. This seems to be too sharp. I use a balloon spacer in a selected population. Please, the next slide. Okay, so there are situations different among the others and different decision to treat these. So we can have a very elder woman with pain, weakness, with several comorbidities that make at risk the patient for a general or a major anesthesia, and the patients that are not willing for a major open surgery. So from the opposite side, we have manual workers or retired men, elder, but active and healthy. And they want to have a very stable shoulder, a functional shoulder. So what happens? We all know that when the cuff tear is massive, there's a proximal cranial migration of the humeral head, and the situation is get worsened by the deltoid fibers that are not under tension. And so the humeral acromial space is a predictor of the good function, because it shows that may have a healthy deltoid or not. So these are the elder people, so as me, as them, these are the people that can have a good procedure, even if the procedure is demanding. So, which alternatives to the balloon? This is the partial repair. I mean, the partial repair is a very effective procedure when we have some muscle. When we don't, we do not have a tenodesis effect that can work properly. But partial repair is an alternative. Then we know he has a clever idea, and it is widespread used in the world. And I mean that it is not just because there's some tissue in between the humerus and the acromion, but look at the stitches at the posterior part, because the infraspinatus is holding on the superior capsula. So it maintains the infraspinatus upward, and thus it avoids the supraspinatus position under the center of rotation of the humeral head. So look, the rupture of the central slip of the extensor digitorum tendon. So the volar displacement of the lateral band, they improve, they get worse in this situation with the proximal joint, interphalanx joint getting worsened. So, and other alternatives, this is the trapezius transfer that you, Bassem, did as magistrally. The trapezius has the vector or the line of forces that mimic the infraspinatus, but I still remain at the latissimus dorsi. Even the proximal fibers of the latissimus dorsi, as in this picture, the proximal fibers are really in line with the the infraspinatus muscle. And so we know almost today many surgeons, they learned how to do a tendon transfer. If few surgeons in the past, nowadays it is going to be a widespread procedure. This is the action of the lat dorsi, and this is the lat dorsi wrapping the greater tuberosity. So we can achieve somehow a recentering of the humeral head with a better humeral to acromion space with a transfer, and the tendon transfer, it works. So, and does not prevent any further option as the reverse shoulder. So, but what to do when the people is elder, is not willing to do physiotherapy, has no money to go to a surgeon, probably is in an area where the shoulder surgery is not so evolved as in our countries. So what to do? And this is the idea that led me to go to game with the balloon. So should be a device that can be inserted easily everywhere, even if there is not a dedicated surgeon, and with local anesthesia. And this is the work I did. So in local anesthesia, the anesthesia of the suprascapular nerve, and then I moved to the just a volume, so water and local anesthetic into the subacromial space. You have a patient ready for the implantation. You can use both the beach chair position or the lateral position. The lateral position is safer because if the patient would have regurgitation, you are in a safe position. Okay, you set the fluoroscopy, so you don't have to do arthroscopy. And the most of the orthopedic surgeons, they are trained to use a fluoroscope, and the rods as in these pictures. In the first one at the left, I enter with a rod into the subacromial space. I check by the fluoroscopy. Then I put a similar rod, similar length rod to measure the length of, or the diameter, the size of the balloon. The central one, I put the balloon in, and the last one, the recentering head. So I did a perspective study with 46 patients follow-up, and I had 3 patients going to reverse, and the other patients, they improved with the IASE score and the other score we considered. So many are the other papers. So this is the National Institute of Health and Care Excellence, considering the use of balloon, so to restore the function. So for symptomatic shoulders not responding to conservative treatment, reducing the quality of life. And these are all the papers, very, very important. And this is the other, that cuff repair protected with the subacromial balloon. So this is another option. So to put a balloon after the cuff repair in order to lessen the peak forces, the peak stress onto the repair. And this I'm doing, I just ended a work doing latissimus dorsi and a balloon over the latissimus dorsi. But there's not that all the different surgeries, they give the same result. This, and I conclude and with this, this is an article that happened, was published on Lancet, April 2022, so last month. And it compares a cohort of 56 patients with balloon and debridement and tenotomy of the biceps with 60 patients with just debridement and long biceps. The conclusion of this is that the double-blind, multi-center, controlled trial, so very the most well-conducted paper, and the conclusion is that the group going well is the debridement and tenotomy of the bicep, and it says we should not anymore implant a balloon. But I'm not for that. I say that in some situation where there's not a possibility of going to make a shoulder surgery, we can do an implant, and in the future, I mean that this will be possible by echography. And this is my take-home message. Do what's right, not what is easy. So avoid too many surgeons doing a balloon because it is easy, but become expert in shoulder ultrasound, as we in the future will be able to make more things with this device. This is my group, my shoulder group in Monastir di Treviso, close to Venice, where I moved when retired. Thank you.